And just want to welcome you all here. Again, this is a really big deal for us, and we're extremely appreciative of your attendance. This is a community forum for our Mental Health Services Act. This is essentially the second of 3 meetings that we're having. The meeting that you may have attended previously, the first meeting a couple months ago, was kind of our introduction for this year's update for 22-23. And this is taking what we've learned from that meeting and refining it to further it for the plan and the creation of the plan, the update, and then we will have the printed version available for review for your review for 30 days, and then we'll have a public hearing following that, which we're hoping will be in June. And so again, thank you for being here, and hope this will be worth your time. We really look forward to your input.
Thank you so much, Scott. Great. So for those of you who are just joining us, just to reiterate, today is Lake County's LCBHS Community Planning Meeting number 2, and this is for the financial year 22-23. Thank you again for joining us today, and I'm just going to kick off our meeting. So again, just a quick round of welcome and introductions. This is just to reiterate, especially those who are attending in person, it would be wonderful if you could take a moment to just fill out the sign-in sheet. And if you're online, we'd love to hear from you. Please use the Zoom chat function to introduce yourselves with your name, your preferred pronoun, as well as the program, if you represent a program. So we'd love to hear from you and learn more about where you're joining us from. So welcome again.
And we also have the demographic survey in the chat too. If you could fill that out, that's really important for our data collection.
Great, thanks for the reminder, Scott.
Yeah, I just put a direct link. I just put that in myself. Okay,
great. Wonderful. So I'm going to get to, hi Wendy, welcome, thanks for the introduction. I'm going to just talk about, just for a brief moment, the agenda and the objectives for today's meeting. We did send the agenda out, so hopefully folks who are joining us today have had an opportunity to look at that. But nonetheless, I'm going to talk through it. So essentially, the first half of this meeting, we're not really half, just the beginning part of this meeting, we're going to be providing an overview of what MHSA is, and then really what Lake County's annual update process entails. And then we're going to, as I said, this is, like Scott mentioned, sort of the middle meeting between the first community meeting and then the public hearing, which we're going to have in June. And what we've done since our first meeting is we conducted a needs assessment process. So we're going to be reporting back about really what we've been hearing from stakeholders such as yourselves about what their needs are with respect to MHSA. And then in addition to the needs report back and discussion, we've also heard some proposed strategies, and really a bulk of today's conversation is going to be focused on thinking through what those strategies can look like, especially as you're thinking about improvements to Lake County's programs themselves. And so this is really an opportunity for you all to weigh in, and we'd love to invite your input and discussion around this because it's really vital to Lake County's programming. Oh, I see someone's raised their hand. Go ahead, April.
The Zoom room before we close public comment.
Good morning. I just wanted to say that we're having a little bit of a hard time hearing you as you keep cutting in and out. So I'm not
sure.
Oh,
do I? Oh, yeah. I'm
Yes.
so sorry to hear that. Oh, can you hear me now? Is that better? Sorry about that.
Yes, thank you.
Yeah, not at all. Thanks for raising that, April. Just let me know in case you're still not able to hear me. So great. I see lots of introductions. Thanks again. Welcome. Okay. And then just thinking through, just with regards to the agenda, there are two primary objectives for today's meeting. Are folks still not able to hear me?
Interesting. I hear you.
Okay. Just let me know if I'm inaudible, please. Okay, I'll do my best to hold my headphone up close if that helps. Okay, so just to talk through, there are two key objectives for today's meeting. One is to use this opportunity to review and discuss the needs assessment key findings, as well as secondly, identify potential strategies and program changes to better address your needs. So very much want to emphasize that today's conversation is really forward-looking, where we'd like you to think through this as an opportunity to help refine Lake County's MHSA programs. Great.
This is just kind of added to that.
Yeah.
With those objectives, we're really looking forward to the discussion today of taking what we've learned from the assessment, which we'll get to really shortly, and be able to use that information, that data to help us determine how we can refine our plan. So that's really what we're trying to do today.
Thanks so much, Scott. Great, just quick meeting tips I want to walk over. I think folks are fairly familiar with this now that we've all been on Zoom and these virtual environments. Just a couple of things for those attending in person. You all must know that there is a coordinator at each site to help manage this Zoom meeting and facilitate your participation. So definitely feel free to reach out to your facilitators, especially if you have questions or clarifications throughout this presentation. If you're joining this conversation virtually, to the extent possible, find a quiet, distraction-free location, and also feel free to join us through via phone. If folks have substantive comments or questions, please use the hand raise function, which we already have someone do, so thanks for that. In addition, feel free to also drop your comments and questions into the Zoom chat function. Great. And then just to make sure folks are aware of the different ways that you can contribute to the discussion. As I said, with the computer, to speak through the computer, click on the participants. Oh, sorry about that. You can use the participant raise icon, which is sort of towards the bottom half of the Zoom screen. You can also, if you want, folks who are dialing in, you can use the raise hand function by pressing *9. The Zoom chat feature is always an option for folks to weigh in. And then finally, for folks who might have comments and prefer sending them by email, we have Scott's email address right here, so feel free to just send an email to Scott. Great. All right, so let's actually get started. This is the first section, as I mentioned in the agenda, where we're going to walk through the Mental Health Services Act. This is the training and education component of
Right,
this.
and we do this just to remind people and familiarize people that may not be familiar with the Mental Health Services Act. For most of you, this will probably be something you already know, but we just want to do it to make sure that everyone understands what we're talking about.
Absolutely. Great. So as Scott mentioned, folks might be pretty familiar at this point in time, but we're going to do a quick recap nonetheless. So MHSA was an act that was passed through Proposition 63 back in 2004, and it's essentially called the Millionaire's Tax, which is a 1% tax on income over those who make $1 million. And the idea and the objective is very much focused on the expansion and transformation of mental health services, sort of using these 5 core values or principles, as you see on the screen, everything from wellness, recovery, and resilience to ensuring services are culturally competent, to make sure that the client and the family are very much at the center of the services, ensuring that they are receiving an integrated service experience, as well as making sure that this entire process is collaborative. So that's just really what MHSA is in a nutshell. To give you a sense for just how the entire program how the different programs are broken up. These are multiple buckets that are part of MHSA. Oh, okay. It looks like my mic isn't working. Give me one quick second. Can you all hear me now? Is this better?
So hi, so this is April again. I think we can hear you just fine whenever you ask us if we can hear you, but when you start to talk, it's like when you move, it kind of fades in and out.
Okay. How about right now? Is this a little better? I've tried to take out my microphone.
I think it was the microphone on your headphones. I think it might be better with a computer mic.
Okay, so you can hear me now, Jimmy? Just let me know. Is it better now?
Yeah, just stay close to the computer.
Okay, I'm so sorry. You know, I have been actually having a bunch of Zoom trouble off late, and I sincerely apologize for that. I will stay as close to the computer, and in case folks can't hear me, please just let me know. Thank you. Thanks, Tiffany. Thanks for raising that again, April. My apologies. Okay, so just to let folks know, this is, like I said, a broad overview of the different components of the MHSA program. So right here, you could see a majority of the funding goes into the CSS programming, which stands for Community Services and Supports. This is really meant to help serve folks who currently have mental health needs. Then you have the PEI piece, which comprises about 20% of the MHSA funds, which is really focused on prevention and early intervention. Then you have about 5% of the funding that goes to innovation programming, which is the opportunity to test new approaches that help improve outcomes. And then finally, we have two other components, which include WET, which stands for Workforce Education and Training, as well as the capital facilities and technology needs, just in terms of thinking through the infrastructure support that's needed to help run the MHSA programs. I'm going to just leave this slide up for about a minute. And this really, what this slide presents is an overview of the different programs at Lake County that fall into these different buckets that I just talked about in the previous slide. So everything under the CSS program bucket, the PEI, innovation, capital facilities and technology needs, as well as WET. So just want to, leave this up here. I think folks are fairly familiar. Go ahead, Scott.
Yeah, I just want to say a few things. So as you can say, it says, fiscal year 22-23. So these are the existing programs. And so we're thinking this is also the third year of a 3-year plan, the 22-23. So we're really not looking on changing a lot of programming in the third year of a 3-year plan. We did do a little tweaking last year. We can do that this year if need be. But we're I think overall just looking at taking the programs which currently exist and trying to improve them based on the feedback that we receive. And so these are the existing programs, and they've pretty much remained the same over the past 2 years and going into the 3 years. Last year we did separate out under PEI mental health first aid, and also really defined the street outreach program as well, and also under state, regional, and local projects that also includes suicide prevention as well. The other thing I just wanted to mention is it has the peer record under PEI has peer support recovery centers. That is also funded under CSS as well. It doesn't list that on there, but peer support centers are actually funded by both CSS and PEI.
Thanks for that, Scott. Great. Okay, so I'm gonna move us on So just for those who are interested to learn more about the MHSA background and overview, we have a link right here. My colleague's going to drop that link in the chat as well. So feel free to take a look at that as you would like to know more about the MHSA program.
There's also a lot of really good outcome data that Patty, our analyst, has put in there. She's just gone through and updated quite a bit of that, of the outcome data. So it's really a great place to look to see what's happening across programs.
Wonderful. Great. So now I'm going to get us into the annual update and community planning process. This is section 2 of the presentation. So just a quick overview just about what the annual update is and what the community planning process has been and looked like. And this might again seem familiar to some of you who were present at the first meeting. So really the purpose of this annual update, and Scott reiterated this, is to provide an update of the adopted 3-year plan. So we kicked off the 3-year plan in financial year 2020. So this is the last of the annual update. And it's really focused on getting a sense of the program status as well as service accomplishments, and really thinking through, like I said, this opportunity is to think about what are some areas that you can actually improve within the gamut of programs we just talked about. In addition, this entire process has been very much focused on hearing from stakeholders such as yourselves, who come in with really the subject matter expertise and lived experiences, and we would love to continue to invite your thoughts and participation. Scott, I'd also like to invite you to just provide a quick update about the RFP process. So go ahead.
Right. And so as we just mentioned, this is we're planning on the 3rd year of a 3-year plan. And one thing that we want to do next year, not this year, but next year, as we're looking at a new 3-year plan, is one thing that we'll be doing for our outside providers. We'll be doing that process through an RFP process, a request for proposal process. The idea that we'll be looking for, we'll be putting out requests for proposals for the services that are provided under MHSA that are already contracted out, as opposed to just simply renewing contracts, which we've done in the past. So there'll be a little different next year. It's not until a year away, but I just wanted to mention it now, so that providers can be thinking about that, and also as community members, maybe there's other things that we can in the future be looking at around that. But the difference will be, instead of just this recontracting, you have to go through the RFP process first.
Thanks, Scott. Great. So I'm going to just move us along. Here's just a list of stakeholders that I just mentioned who are part of the community planning exercise. So we have everyone from consumers of the mental health services down to providers, as well as other agencies that Lake County Behavioral Health Services collaborates with. And just want to sort of leave this up here for a few more seconds so that folks can get a sense for who the stakeholders are with the MHSA program. In addition, just want to highlight a couple of key roles and responsibilities. Again, just to reiterate, the stakeholders are very much at the heart of this planning process. So thinking about your perspective and lived experiences are really vital to thinking about program improvements in the future of MHSA at your county. BHS, the Behavioral Health Services Department with Scott and his team are really tasked with implementing the programming. We have the Mental Health Advisory Board, so they're really an advisory member who help with the refinement and advice on the annual update process. We have the Board of Supervisors who provide the final review and approval. And then we have us, who we're really very much here to help facilitate this entire conversation. So these are the sort of some of the roles and responsibilities we wanted to highlight. And then this slide just really provides an overview of all of the activities that we've been involved in. So as you can see, we're in phase 3 right now with the program planning phase, where, as I want to reiterate, this is an opportunity to really synthesize stakeholder input on needs and services, as well as identify potential updates to the MHSA plan. Moving into the next phase, and Scott mentioned this, that we will be developing the annual update, and we will put the annual update up on the public posting for about 30 days, and then we will launch the public hearing, and the plan is eventually going to be finalized by the Board of Supervisors. So this is just to provide everyone an overview and timeline. All right. And then now I'm just going to launch a really quick stakeholder poll. And this is just, again, a quick reminder to folks at the peer support centers, if you could sort of manually take this poll and ask folks at the peer support centers to raise their hands. And I'm going to just quickly launch this poll. And for those of you who are joining us online, just take a few minutes to respond to this poll. Hopefully folks are accessing the poll right now. This is really just to reiterate a quick sense of if you have a reasonably good understanding of the MHSA's annual, the MHSA program as a whole, as well as Lake County's annual update process. Thank you, please. I see we have about 25 participants joining us. Okay, great. I think there are a few from the peer support centers as well. I'll leave that up for just maybe a few more, like 30 seconds or so. Great. Looks like we've had most folks participate. Wonderful. So thank you all. Thanks for your very quick participation in this poll. It looks like about 50% of folks sort of are in agreement that they have a reasonably good understanding, and there are about 21% of that who strongly agree, and there are fewer who feel that they disagree with an understanding of MHSA. So this is just a quick overview. Thank you all for your participation. There we go. You can quickly take a look at the results if that's helpful. Great. Thanks again. Okay. So now I'm actually going to move us along into the next section, and that is focused on providing a report back of the community and stakeholders needs assessment process. I just wanted to reiterate that that was what we were doing, especially over the last 2 months. And so we've done some analysis on our end, and here's an opportunity to present what we've heard back to all of you. So before we actually get into some of the data, wanted to give everyone a quick overview of just the folks who participated in our needs assessment process. So this table right here to the left-hand side of my screen is just to give you a sense of all of the different data points and where and the kind of activities that we conducted. So as some of you might be aware, and I think some of you were participants, we had our first community meeting back in February. So we had about 58 folks join us during that call. In addition, right on that, at that call, as well as a little before and after, we had launched our community survey, where we had a really great participation from all of you, where we had about 88 folks participate in the survey. And then in addition, we also conducted focus groups. These were at the peer support centers. This was back in March, where we had a total of 24 participants. So with the total being 170 really across. And then just sort of looking at—
That is a really big number, compared to previous years. And so really appreciate you all participating and helping us out for that.
Absolutely, completely echoes Scott's thoughts. Thank you so much. And if folks are interested, this is sort of just the way the stakeholder affiliation is broken out. You can sort of see pretty much an even distribution amongst those who identify as other community stakeholders, family members of consumers, as well as consumers. So it's actually a pretty even distribution, and that's always something we like to see. So thanks again for your participation. It was very, very valuable. And here are the results. So right here, as I mentioned, we had launched the community survey, and this is just a broad overview of that community survey slide. So as folks can see right here, just to give everyone a sense for how to make, how to understand this particular graph, about 3/4 of the survey participants felt that agencies are working very well together to help coordinate mental health services, and that the mental health workforce has the necessary resources to safely provide mental health services. In addition, about 1/3 of survey participants felt that Lake County's mental health services can be a little hard to access, and that the county still needs to make some improvements towards adapting the community's changing needs, especially during the pandemic. So this is just a sort of brief overview. Overarchingly, we found that a lot of the respondents had more positive things to state about the program. And so, this is just to give everyone a sense for how the survey results unfolded. Great. Now I'm going to just move into the needs assessment strengths. And so this section is really thinking about overarchingly what were some of the positives or elements that folks feel very supported by through Lake County. So peer support centers, they were identified as being a very critical key strength for multiple reasons. So one of the first ones being that peer support centers really have provided a sense of safety, comfort, as well as emotional support and camaraderie for a lot of consumers. They're seen as very resource-rich hubs to fulfill a wide range of consumers' needs, even beyond behavioral health, such as things like job placement, getting supplies for their families, access to food banks, etc. And in addition, folks also talked about peer support centers having a very strong referral network to needed services like behavioral health and other social safety net programming. In addition, telehealth and virtual services, especially consumers have said that they really like the opportunity to think of this as a real option for consumers to log in. And so you could see right here in this little sort of bubble, which is really a quote from one of the survey participants, where they said that remote access to therapist sessions and the ability to reach people even when they work at home has proven to be very beneficial. And then just to reiterate, resources and supports that the MHSA programs provide have been really well received, especially during the pandemic. Things like baby supplies, access to food, groceries, even access to computers and telephones have been really sort of vital and important. Big shout out to Motherwise. We heard a lot of really positive thoughts around postpartum mental health services that folks have received. And then overarchingly, LCBHS staff were noted to be really supportive and friendly. So you could see again, a statement by one of the consumers at the peer support center state that it is a very safe place to come and check in with like-minded people. They're very much trying to better the community. So we just wanted to give folks a sense for what we were hearing in terms of thinking through the strengths of the MHSA program at Lake County. Okay. So with strengths, there are obviously some opportunities for growth and certain challenges that folks also brought to our attention through the needs assessment findings. One of the first ones being COVID, as that is definitely something that we're all still sort of contending with. So COVID-19 has had and continues to have, unfortunately, an impact on services. And also this pivot to virtual services, while it seems to be working for some, it's not necessarily accessible or appropriate for everyone. And a lot of that has to do with the fact that, folks may have unreliable access to technology. There may be a lack of digital equity and literacy. And in addition, there's been sort of a slowdown and stoppage of services really across the board. And that's really unfortunately true for really programs across the board, not necessarily only with MHSA at Lake County. And in addition, one of the things we've also heard is just that the stress of the pandemic has unfortunately enhanced existing mental health conditions or even fostered emerging ones, given that folks are continuing to experience a lot of social isolation. The other sort of area that folks identified was the fact that there continue to be sort of insufficient staffing, especially across the different programs. And we remember also hearing this, especially at the first community meeting, where there's just not enough staff. And then related to that, that staff turnover has been reasonably high. This in turn has sort of affected continuity of care, service availability, outreach, as well as providing timeliness of services. And then, some staff has also identified that there could be opportunities for improving training, especially on things like what are the specific eligibility criteria for consumers with respect to accessing certain services. In addition, we also heard folks talking about issues on housing and homelessness. There continue to be barriers to affordable housing assistance and or homeless services. So everything from a lack of space, facilities, as well as the kind of services for homeless folks. There appears to be a limited housing inventory, largely due to the fires and rent increases, which makes affordable housing really hard at the county. And then also there's generally a sense of just a sort of lack of awareness or inaccessibility of some existing homeless services and resources. The other piece that was brought to our attention was this notion of timeliness of services. This was especially stated in terms of thinking about long wait times for scheduling appointments, especially with external mental health providers, and this is particularly true for new consumers. In addition, we heard that there's a lack of crisis services in inpatient settings, which leads to people who are in sort of an emergency situation waiting around for days. This can be sort of potentially traumatizing for some folks. And then just really not receiving quick updates from MHSA providers. That was also another issue that was raised around timeliness. There continue to be some barriers to accessing services, although with the peer support centers being put into place, we're definitely, I think the gap is being bridged there. But we did continue to hear some things around just the stigma that surrounds mental health. There's a lack of awareness in general in terms of how and where exactly to access these services at Lake County. Sometimes the location of where these centers or services are has been a little challenging for folks. And in addition, other pieces such as language continue to be a potential barrier for some folks. And then finally, the piece I wanted to talk about is this notion on service gaps and a lack of infrastructure support for care coordination. For instance, things like a need for more residential treatment facilities, especially for folks who need support 24/7. And it's obviously a little bit of a step down from inpatient support. In general, folks also said that there may be insufficient funding available to the Lake County. And this is specifically true for crisis services, and that there's still sort of ways to improve care coordination and also provide the adequate supports and resources, especially for families. And then on this left-hand side of the screen is just want to sort of highlight some populations in need that were brought to the forefront by some of the folks who participated in the needs assessment process. So talking about homeless individuals, homelessness was definitely an area that folks have been concerned about. The need for youth and family services, especially as well as family members or loved ones. So things like prevention and early intervention efforts, especially services that don't target young children under the age of 2, youth programs to help preteen and teenagers deal with mental health issues, youth substance use prevention programs, mothers or families struggling with perinatal or postnatal depression, and then just really greater support for families who are in transition. For instance, those who might be separating or undergoing a divorce. Older adults was another area where there was talk about just not having enough outreach to senior support members, specifically for the senior population, as well as programs supporting volunteer caregivers almost are sort of non-existent. And then finally, we have the communities of color. And this is especially for folks who feel like they don't subscribe to the Western medical model. And that they continue to feel this need for additional support. That was a whole bunch of information that came your way. I just want us to pivot, and this is really where I'd like to invite folks' thoughts around what I just presented to you in terms of the needs assessment findings. We'd love to hear about whether these findings resonate with you. Were there any findings that were particularly surprising that you saw? And then are there some needs that we might have missed? We'd just really like to invite some discussion or just hear from folks if they had any thoughts about the needs assessment report back. Go ahead, Betsy. I see you've raised your hand.
Oh, thank you very much. So, of course, I'm the lead proponent always on the older adult issues, which I find are totally ignored, except in these reports. But the issue that I think is not considered at this point and needs to be is emergency management and disaster preparedness. Mm-hmm. I don't see anything discussing the impacts on the populations that need these forms of assistance during wildfires, during emergency evacuations, getting the information out to people who have cognitive impairments. That's just a whole area of concern. I just want to raise that to everyone's attention. Thank you very much.
Thank you so much, Betsy. Really appreciate you bringing that. Did anyone want to add or any other thoughts about the needs assessment piece? Feel free to chime in through chat as well, even folks at the peer support centers. If anyone has any thoughts, feel free to unmute yourselves, please.
I just want to say, so Tiffany put a comment in the chat that Scotts Valley is hosting that information to their members that Betsy was just speaking about. Thanks, Tiffany.
Great, thanks, Tiffany.
Hi, Ishel Sparks. We don't have any disaster preparedness in tribal communities. We've been fighting for years for that, and we don't have it. And we, along with the disabled, are the most underserved populations within the United States. So we keep saying things, and it keeps not being addressed, and it's a very serious problem because of the areas that our lands are, our reservations are located. A lot of them are really remote. So it serves as one of our biggest problems, especially in the areas of domestic violence and sexual assault. So it keeps being brought up, but nothing is done about it.
Jen?
Thank you so much for raising that.
Okay, Janet Taylor here. I think we're going through a lot of changes in Canuck by senior support, and I almost feel that one person there should be identified to deal with elders and different cultural needs, because there's so much need in the Native communities, for instance, Black communities. You almost need somebody that has some training in that wants to specialize. I was given Latin elders just because, you know, they just happened to happen to me. But boy, did I have a crash course because they gave me the county court translator. Boy, she had to educate me. So, you know, you need some people trained in this cultural diversity. Pay attention to elders. They need this for peer counselors. Thank you.
Absolutely. Thank you so much. Very valid points. Thanks for raising them. Any others? I see a comment from Samantha. Thanks, Samantha. It says addressing infant and early childhood mental health beyond just postpartum depression. Absolutely. Thanks, Samantha.
Yeah, again, Ishel Sparks, member of the community here in Lake County at Habenico. And our elders are one of our most underserved within the underserved population. And, you know, tribally speaking, culturally, I'm sitting here right now with an elder that I greatly respect. And it's important for me that they get the services they need because, you know, I have a 17-year-old son and 19-year-old daughter. And, you know, my son even says, I need to go sit with Uncle Thomas. And those, if our seniors aren't well and they're not taken care of, then they don't get to pass on their wisdom and the traditions to our younger people. And that's one of the problems with our communities is that our young people don't know our traditions, and our elders, they die earlier than other ethnicities. Our death rates are earlier, they're in the 50s and 60s. And so when we have someone that is past that, it's a blessing to us, but that's not the norm. And so really looking at taking care of our elders is huge for our communities, and especially with our populations. We have low populations, and it's continuing to decline. So it's of great importance to us that that be addressed.
Thank you so much for raising that. And I completely agree. Thank you. I see Irma's dropped a comment around developing community college partnerships to assist students enrolled in college with mild to moderate behavioral health issues. Great, thank you. Thanks for raising that. I definitely don't want to stop the discussion, but I do need to move us along into some of the strategies report back, and hopefully this can help thinking through just some areas for improvement that all of you have also raised. Scott, did you want to add something?
No, I'll when we get to the
Sure. Okay.
Update, I'll say something.
Absolutely. Oh, and I see Betsy's response. It says Woodland College has established a hub for student assistance. That's great to hear. Thanks for that, Betsy. Okay, so let me move into some of the proposed strategies, and we'll definitely, circle back. I feel like with the strategies discussion, we're very much going to talk about some of the very important needs that all of you have just highlighted. And here are some areas that are, which folks have also identified as areas for improvement. Okay, sorry, give me a quick second. Okay, so let me bear with me. There's a lot of content in these slides, but I would really like to talk through them because these were very much identified as key areas by really all of the stakeholders who participated in these conversations. So one of the first pieces is around raising service awareness, outreach, as well as improving access to services. So let me just get into some of the bullets under this. So one is overarchingly just really educating potential consumers and the broader community about mental health. We've very much heard social media as an avenue to build that awareness, but I think folks are striving for more beyond social media. There's also something that we've heard from consumers, which is if there's a way for LCBHS to help devise or automate a technique for sending appointment reminders, because I think that has been identified as a critical need really across the different populations in need who are consumers of mental health services. Continue to have opportunities for consumers to be social. This is really specific to the peer support centers, where we heard from folks saying that, the fact that they were coming and having art classes together and cooking classes, obviously this is all contingent on safety around the pandemic, but I think there's definitely folks who'd like the opportunity to continue to be social. Developing pamphlets at each peer support center, just sort of listing out the kind of available resources could be really beneficial, especially for consumers who are sort of figuring out whether they'd like to continue accessing services. And I think that was seen and identified as a key strategy. Improving the overall mental health facility appearance, because I think what we've heard is, some facilities are not particularly appealing or inviting to consumers or even other members who are trying to gain more of an understanding of mental health services within the county. So if there's an opportunity for improving that appearance, expansion of mobile services and outreach in general was another huge area that was identified. And I think Scott's going to give us a little bit of an update in the next couple of slides around that. Supporting families impacted by COVID-19. I did mention to all of you that, COVID-19 continues to unfortunately have impacts on, on the mental health services and access to that. And so what does that really look like? And then also ensuring that the resources are really bilingual, and that again addresses some of the accessibility concerns that people have raised. And then really organizing more mental health wellness workshops specifically for non-acute consumers. That was one of the things we heard from folks as a proposed strategy in this broad area. The next topic I wanted to talk about was service coordination. There was definitely this notion of improving mental health provider networks. And is there a way for Lake County to actually increase the total number of networks to help shorten the appointment wait times? Because that, as I had previously talked about, has really been a barrier to accessing services, and that folks are not being connected to other mental health providers fast enough to do that. And so that continues to be a concern. And then just sort of improving accessibility, especially with partnerships with other external agencies around raising more mental health awareness, because as I said, there continues to be a barrier just in terms of getting through the front door that folks would like to see an improvement on. And then the third point here around service coordination is really increasing service equity and ensuring consistency of supports across all peer support centers. That was also something we heard being stated up front. Okay, I'm going to move us into the next proposed strategies section. So for this one, folks also identified a need for new services and interventions. So this included things like developing a mobile crisis response team, but with a very specific niche on really not having any police intervention, because that is a really key point around really having an opportunity for a mobile crisis response team that's really made up of mental health providers and clinicians instead of the police. Implementing residential treatment facilities or multiple or a facility. Starting the Promotores program, which is very much seen as a program that has ties to the community and helps with the linkage of services. And then we also heard folks talking about opening a peer support center for children and youth in the city of Clear Lake. That was definitely an area that feels like the youth in that part of the county are not receiving the appropriate needs and services as they would like. Starting a student crisis team, especially in schools, because schools are an opportunity where we've also been hearing a lot of mental health needs that are being surfaced, and whether there's an opportunity to build a student crisis team. Paying stipends for community members and other agencies of color to really share their experiences and lead conversations on how better to serve their needs. That was a really very important point, and I think some of you also raised this in our needs assessment discussion. Because it's really important to hear from their lived experiences of how they're experiencing the mental health services programs. And then also, folks talked about opening an emergency homeless shelter for our day-aged youth. And, because unfortunately, folks have talked about how there are a lot of minors who end up becoming homeless at the county. In addition, we also, folks talked about services that could be catered to specific populations. So everything on, around affordable or low income housing, like, is there an opportunity to actually develop more homeless shelters and increase the options for affordable housing within the county? Talking about older adults, I know folks brought this up in the needs assessment discussion. Folks have talked about things like a need for more in-home assistance, especially for older adults and their caregivers who feel isolated. Is there also an opportunity for Lake to help the Area Agency on Aging to advocate for improvements to delivery of services that are mandated in the Federal Older Americans Act? In addition, we also heard that there's a need for services for families specifically. So everything around parental training, need for supports on being a caregiver for someone who's actually going through a mental illness, and other resources and support groups for family and loved ones. So this includes things like peer support staff specific to children and Tay and Clear Lake, increasing access to therapy, even especially for youth, and then really services for new mothers requiring mental health supports. And then the other bucket that we wanted to talk about just in terms of proposed strategies are around workforce education and training. Is there an opportunity to improve and expand the WET incentives, especially to hire and retain staff? Because if you all recall, that continues to be a challenge in the county. Is there an opportunity to help create a more diverse staffing pipeline, and also make sure that the kind of training they received is up to date and more frequent? And then finally, there is this piece on expanding really the pipeline of counselors or therapists in the region. Because as I mentioned previously, that folks, they have really long wait times between being referred out to a mental health provider. So is there an opportunity to expand that pipeline overall? I'm going to just now call on Scott. On this slide, what we've done is LCBHS, since the installation of the 3-year plan that is from financial year 2020 to 2023, have been actually working on some pieces. Scott, please go ahead and provide us an update.
Sure. First of all, just appreciate RDA for putting this together, taking all that data that we've gathered and organizing it and categorizing it and making it presentable. It's a big task, and I appreciate the effort they've done to be able to bring this presentation to you. It's also heartening, I guess, or positive, optimistic to recognize that of all the points that were previously brought up over the last couple of slides, we're actually addressing nearly all of them, not all of them, but nearly all of them presently, which is good. And I guess we just need to get that information more out there, how we're doing it. Some parts that we're just starting, other parts we've been doing for a while. This particular slide right here is just some highlights of some things that we are doing. For example, we are increasing our technological abilities at the peer support centers. As you can see, we're doing hybrid meetings at all our centers right now, so that they can participate. We're always, trying to meet the needs of our clients there, and technology is one of them. We have an outreach van for services. which we obtained late last year. It's a decorated really nice, I guess you could say, or it appears really nice. You shouldn't be able to miss it. It has nice colors on it, and it will be we'll be utilizing it very soon. We are creating partnerships with other agencies to be able to go out together and use it and try and reach more people. Utilizing community health workers as part of the new Pathways Hub. Let's see, how do I talk about that very quickly? The Pathways Hub is our previous innovation project, which is still ongoing. It's now being funded by the Whole Person Care Grant. It's the idea of trying to network different provider agencies to work together, be able to provide referrals and coordinate care. Adventist Health is currently the hub for that, and they're getting training, and that utilizes community health workers and peer support staff to be able to meet the needs of consumers and be able to get them linked to services across the county, to all different types of services. Trainings offered virtually. That's pretty easy. I think most places are doing trainings virtually these days, and we've joined that. We've gotten an electronic training platform to assist us with that as well. Service coordination, new Pathways Hub for improving coordination. I think I just talked about that. LCBH partnering with Hope Center, Housing COC, and Housing Navigation Committee. So that's concerning that, you know, our housing continuum of care, of which LCBHS is the administrative entity. And so we're always trying to improve the housing capacity and reduce homelessness in our community. And that's you know, important partnerships are involved in that. Hope Rising being one of them, to hopefully find housing, as we know, is a big issue, not only in our county but across California. Service specific population hiring, outreach, prevention, senior specialist. Betsy, hopefully that makes you feel good. We are indeed hiring right in the process right now. We have a candidate and we're going through the hiring process for a prevention senior outreach specialist. We are also doing the same for our Circle of Native Minds and the Native American community. So the recent discussion that we just had here within the chat and here, I think hopefully those two positions will go a long ways to address those needs. We are again hiring.
I'm sorry to interrupt. Can I just jump in? I also wanted to add to that, because our mental health adult team is splitting in two, so to speak, and they are creating an older adult team on the mental health side to address some of this. They have already started attending the Area Agency on Aging Advisory Council meetings, and I'm excited about this prevention specialist position, in that they will work closely with our newly created older adult team. So just wanted to throw that in there as well.
Right. Thanks, Todd.
Thanks, Scott.
Let's see, I mentioned we still need to rehire a parent partner for families. We had a great one, and she moved over to our children's team, transferred over. So we're now in the process of hiring another one. It's a really important position that will help with the support and training for parenting, and you know, some of the things that I mentioned previously. Youth grants for early psychosis and mental health services. That's a grant that's partnering with MHSA's early intervention services, and it's strengthening that program and will include employment support. So we're looking forward to that really getting going. Ideas for a drop-in youth center in the south end of the county. That's been brought up, and so we're looking how to address that. One thing that we're proposing, which I'm sure will be in this update, is looking at how to do that for this coming year. one of the ideas that we're looking at is taking the peer support drop-in center in Middletown and expanding it to be able to provide to be able to be a youth center. It's already a family center, but if we focus it more on youth, that might help start to address that need. Right now, unfortunately, it is being underutilized. Part of it, I think, is because we opened it during the pandemic, and I think that created some issues. But I think just helping to redefine it might be able to improve utilization of that center. Workforce education and training. We have some really exciting things happening in our workforce education and training. Creating guidelines for peer support specialist certification. That new law that passed this previous year has been implemented. We are joined within the state efforts to provide certification for our peer support specialists. We've contracted with Cal MHSA to do the peer support, the certification process itself. The grandfathering process is being created right now. So over this next few months, this will really be implemented. It's really exciting because with certification, there's also the ability to be able to build Medi-Cal with that for people that are open to Medi-Cal. I mean, for clients that are open to Medi-Cal can also have peer support services as well. We have hired a WET coordinator, which is Danny McEntee, and he's getting on board and learning as much as he can, and bid to bolster our exhibit. Let's see, before we get to that one, I just want to mention the other thing about WET is we are also involved with the regional process, regional partnership that provides loan repayment and scholarships and stipends for graduates. We want to expand that with our other WET money to include undergraduates and people getting into behavioral health. And then we do have, it says there bid for a grant for bolster for existing capital facilities. We have gained a planning grant for that, for a statewide planning grant to help with that. So that along with MHSA funding will hopefully help bolster our facilities and improve their appearance and make them more welcoming. Okay.
Thank you, Scott. We do have 2 hands raised. Betsy, why don't you go ahead and.
Betsy.
Well, thank you. Yes. I was just going to say, I'm sending an email to Todd, but it will contain the information about this subject. I want to inform you of the Area Agency on Aging Advisory Council has a new committee, a subcommittee called Seniors Thriving, and they will be meeting this afternoon. We deal with a lot of these same issues that you've just discussed, plus emergency management, plus end of life preparedness, which is a subject that actually we all have to face, and it is never, ever discussed in a mental health context. I just want to mention that. It's a very important issue for us. Thank you.
Okay.
Thanks, Betsy. Raven, it looks like you have your hand up.
Hi, sorry, were you calling on me? We have some crying infants up in here.
No problem.
Kim here, program supervisor of the Harbor on Main Youth Resource Center in Lakeport. I just wanted to touch back in regards to the ideas for a youth drop-in center on the South Shore for one. Totally agree that it's an area of need that should be recognized as well. Earlier this week, however, I was informed that this was going to be another transitioning youth resource center. And so I'm not sure if that's a focus. My understanding is that there is a need for school age services and support and families, but I had been informed that it was going to be another TAY resource center. Can someone speak about that, please?
I'm sorry, say it again, Rita. I didn't make out all you said there.
I'll come closer. So earlier this week, I was informed, can you hear me better? Is this helpful? I don't know
Yeah.
where our mic is.
Yeah, that's better.
Yeah.
Thank you.
Okay, I don't need to see me. So we totally agree that there is a need for a drop-in center and increased services and support for school-age children and families on the South Shore. What I was told earlier this week, however, is that that family support center might be actually shifting their focus to be supporting more transition-aged youth. And so I'm just wondering if I can get some clarification around that, because there's been emails sent out, for example, from GravD that explain that there is a need to be supporting younger children and their families, but then I was told that this is going to be a TAY resource center. So just curious if someone can provide some clarification around that, please.
Right. So kind of what I was mentioning earlier is there has been an identified need for more of a TAY age peer support center on the south side of the county. And so that's what we're looking at with the family support center, is being able to expand it to be able to provide some of those services, to be able to have some ability for youth on that side of the lake. And as far as younger children and the need for that is also an identified need. One thing I think that everyone has been affected by is staffing, and being able to provide all the services as necessary. Our department is no different than others in being affected by the grand resignation, I think it's being called. And so, we're working with staffing, and so we're also looking at trying to contract out some of our children's services. And so that's hopefully will help address some of the youth services that are there's definitely a need for.
I guess I'm just a little unclear as to why this would be still a TAY resource center, why we'd be adjusting the focus from a family support center that supports already. The focus goal is an entire family, right? So that can include school-age children and their parents. Why the focus is going specifically towards TAY youth? Am I misunderstanding that? There's a lot of background here. I understand there's a need. We have the Clear Lake Youth Center out there.
Yes, there's definitely a need. The family support center is not being utilized very, very well. It's our least utilized of all of our centers. And so we're looking at refocusing in that to meet the need of a TAY center to address that need, which has also been identified. Does that answer your question?
I suppose it doesn't really make sense to me on this end why we would be restructuring an existing center when maybe there's some other alternative opportunities to increase engagement and outreach within that community. So I can almost see relocating to serve a larger population. My concern, is that we're the only contracted peer support center. And I'm understanding that we're having to submit, instead of continuing contracts, we have to submit RFPs now moving forward to continue these types of services. And does the goal of Lake County Behavioral Health to keep programming, all of these programming in-house?
No.
It seems like it's the concern of us that we might be pushed out. Why contract with RCS?
Raven, I wouldn't worry about that at all.
Yeah.
The work you do is wonderful. It's outstanding. Okay. And that has nothing, and I repeat, nothing to do why we need to do RFPs. RFPs in no way reflect on our department's appreciation of the work that our providers do. Our county, our board of supervisors has requested our department to do RFPs because honestly, that's what we're supposed to be doing for services. That's what governments are supposed to be doing. They're supposed to be doing RFPs. And so they've asked us to do that, and that's what we're going to do.
Certainly.
So, but it has nothing, just again, nothing to do with the confidence in the services that are being provided. Okay. we are extremely appreciative of all the services that are being provided, both inside our department and outside the department. Recognize that our staffs, our community-based organizations, I've worked with all of them, and I know how hard they work. That's one of the strengths of Lake County. We don't have maybe a lot of resources, but the resources we have are extremely fine. They work the hardest they can with what they have. And that's recognized. There's no question of that. Okay.
Thank you. Scott, we did have 2 more hands raised.
Yes, I'm sorry. I saw Zabdi's there.
Yeah, Zabdi, go ahead, Zabdi.
Hello. So my role, I mean, I'm working for the behavioral health, but really I'm also a community member, and I have other roles around the county really that's focused on children and youth. And also I've been a part of the children's team for about 7 years. So I want to echo the fact that I don't think that having Middletown, have the addition of TAY is a bad idea, just because there are TAY youth all around the lake. So we would really just be increasing our ability to support youth all around the lake. And throughout the years, I have received a lot of inquiries for services around the lake, and at the same time emphasize the fact that the majority of our kids live in Clear Lake. So yes, I love the idea of having more in Middletown, because also that there's a need there. Lakeport's doing an amazing job in Lakeport. Clear Lake, we know that there's a huge population of children there, huge. The need is ridiculous. And quite frankly, even if we have all of these programs to recruit, and if we bring in mental health services to the schools, the workforce is not here. So I can stretch myself as thin as I want, but the reality is that the need is extraordinary. So I just want to emphasize the fact that if we can provide preventative supports in Clear Lake, where a huge majority of our kids are, then I feel like that we would be making a difference that in an investment, really. And we can partner with the schools, we can partner with the city, we can partner with the majority of folks, and I am happy to support in that way, even if it's off my time at behavioral health. But I know that that's a need, and that our community has also voiced that need. So that's the end of my thing.
Yeah, and I'm not denying that there is a need. I frequently, talk about equity among peer support centers too. And I totally agree that there is 100% a need. We do our best to service the whole entire county, and we don't have the funding. Well, I didn't realize my wrist was all up in there. Sorry. We don't have the staffing. In fact, our staffing, I have 1 peer support staff and a part-time me, and that's it for the harbor. And so I do try to look at, what can we do with this minimal amount of staff? So there's no denying that there is an absolute service need on that South Shore. There's no denying that at all. It's just one of those concerns where we are the only contracted peer support center, and we are grossly understaffed and really, frankly, underfunded when it comes to what the ask is of us, right? And so I just want to ensure that as we're considering an expansion or a restructuring of additional peer support centers, that we're considering that all of our peer support centers, even those not housed under behavioral health, have the same resources, staffing resources, funding resources, so that we can all be providing the same level of care and support to our consumers. There is in no way, we are fully in support of any additional services that are going to go towards helping our youth and their families across the counties. It's to ensure that we're going to continue to be able to do this work in a way that is equitable as well, and so we can all be providing the same level of care for our clients. And that's me done with my soapbox. Thank you.
Thank you, Raven. I do need us to move along, but I know that Thomas, you have your hand raised, so please go ahead.
Hi, this is Ishel Sparks, sitting with Thomas. Again, I've been a victim advocate for over 25 years, and a member of the tribal community my whole life, 51 years. And I've been in meetings all the time, and these are frankly the same things, same topics we've been dealing with for years and years and years. And one of the things I see from a cultural perspective, and I see it out with these different agencies, is that there's not enough support for the parents. A lot of it, I understand that there's sexual abuse at homes, there's domestic violence, there's drug addiction and different things. But a lot of what I've seen too is children flat out being rebellious and agencies undermining parents by dealing with the youth and not helping there to be a reconciliation or, you know, somewhere safe for the parents and the kids to talk and work things out. I don't see that happening enough. And I think even in our tribal communities, when we're talking about resources, our elders aren't being used for the resource that they are to help bring children and parents into a healthy relationship. And, you know, some of these things don't cost mega bucks. It just takes hearing us, respecting what we want, and implementing it, and allowing us to implement it without having to go through all kinds of surveys and all these other things. It takes it out of our hands. People tell us what to do, and they give us so much money and expect miracles, when if they would just come to us first, ask us what we need and how we want to do it, we'd be able to fix some of these things with our transitional youth. We would really like more time at the table when it comes to that, but we still don't seem to get that. Our parents having the influence on their children at least until the age 18 is a huge responsibility and need. It's a necessity to finish rearing our children to face the world. We don't, when they're gone from our homes, we don't have the influence that we should on them. And I frankly don't like the idea of agencies with different values than us having more influence on our children than we do. So, you know, and then I would like to say this because I'm not going to be here very much longer. The use of this communities of color really bothers me. My daughter is if you looked at her, she's very light skinned and she has blue eyes and blonde hair. She is Jewish. She is a Pomo, Habenapo, Pomo, and she's Hispanic. And you would never know it looking at her. But for her to be having to be categorized as not having color versus a person of color, I think that, you know, we have cultural diversity, and but using that color, I see some things on this form. The demographics form that just does nothing but separate us into just wall after wall with asking about sexuality, what's your race, and then what's your ethnicity, you know, just breaking us down into these little groups when what we need is more cohesive and collaboration, cohesiveness and collaboration. And these questions just, I mean, they're culturally offensive to me. So I just wanted to share that. I appreciate the efforts that you do make, but I also feel like I'm part of the problem if I don't share what my perspective as a tribal woman.
Thank you so much. We really appreciate you bringing that up to our attention. Thanks for your inputs. Scott, did you want to respond, or can we move us along? We're actually a little ahead just in terms of our schedule. We were slated to get into a 10-minute break. I unfortunately might need to shorten it down to 5 minutes. I'm looking at my clock right now, so we're at 11:20. Can we all get back at 11:25? I know we just had a long conversation. I definitely want to give us an opportunity to get into some more extensive breakout discussions and conversations. So if folks can all return by 11:25 a.m., that would be great. Thank you so much. All right, it's 11:25 on my clock. Just give folks another minute or two to log back in. Thank you all. Thank you all for raising really important thoughts and comments. I feel like, with the next section, as I had mentioned previously, we are going to be getting into some of these strategies, discussion and conversation. And I feel like we're already sort of there. And so again, want to reiterate how appreciative we are for hearing from all of you. So for this next section on the strategies discussion, just want to reiterate that the way we're thinking about this format is these are three sort of broad areas and questions we'd like all of you to have conversations around. The first one being what can be done within existing MHSA programs to better improve services? What are some new strategies that may be needed and especially need to be addressed? And what would be needed to help implement these strategies? So again, would be really helpful for everyone to think about what are some areas and opportunities for refining what we have. And in addition, as folks have also raised, what are some new areas we may need to explore and make services better. What I will do for this, and please, I apologize, we're trying to make the hybrid model work, is I'm actually going to now go ahead and set up breakout rooms. We're going to have virtual breakout rooms, and this is really for all the participants that are joining us virtually. In addition, as requested, it would be wonderful if the facilitators at each of the peer support centers have independent offline conversations. We're going to mark this for about 10 minutes. And then the idea and the objective is after we've all had our strategies discussion for 10 minutes, that's both at the peer support centers as well as through the virtual breakout rooms, we'll all reconvene, have a short report back. Would love to hear just some of the high key level takeaways from each of the breakout discussions, as well as from the peer support centers. And then we'd like to spend the next 15 to 20 minutes just having a larger group discussion. In fact, I might also just take down the slide deck, and it would be great if folks would just like to talk through some of the pieces in terms of thinking through proposed strategies. I hope that works for everyone, and please do let me know if anyone's having trouble accessing any of the breakout groups. I'm going to go ahead and actually launch it. Give me a quick second. All right. All right, I'm going ahead and assigning folks to rooms. Please
Is there any questions about what we're supposed to be doing in the breakout rooms? Everyone taking notes of these three questions here, hopefully.
When we go into our breakout rooms, can you post the questions in the chat so that we can all see them, please?
Will do, absolutely.
Great idea.
Thank you. And just a reminder, all of the folks at the peer support centers, please definitely use this opportunity to have this conversation, and we will reconvene in a larger group setting. I apologize. I will also provide a heads up closer to 2 minutes up for the small breakout group discussions, and there may be a Zoom snatch, and that's just the way the Zoom feature is set up. And so I apologize in advance, but we will be giving you a sort of warning. All right, see you all there. Thank you. Thank you all. I think
It did have a 2-minute pullback time, just so you know.
Oh, okay, great. Well, thanks so much for that, Samantha. And I was going to say, if folks want to weigh in a little bit more until folks, the other folks come into the room, please feel free. I apologize. I think I had a mix up with the timing because I got a prompt from Zoom. So, Patty, did you want to say something?
No, I was just going to reiterate what you said. I appreciate all the feedback. The discussion in that breakout room was really good. I was supposed to circulate the breakout rooms, but I didn't want to leave that one. So
Yeah.
wanted to stick around and hear what everyone else had to say in there.
Yep.
Especially the alternate service hours. That's something I know that one of our centers is already exploring that. Big Oak Peer Support Center, Davey has been since last summer doing some weekend hours and some after hours services there. And I think that is something that all of our peer support centers should, at some point, we should be able to upgrade them all to do stuff like that, because after hours is probably the best time to offer services to our community.
Absolutely. That is a very valid point. Thanks for that. Thanks for reverberating that, Patty.
Just a side note too on that piece of the after hours. Well, I think it's really important. It's also really important to understand that if they have children, those after hours are going to be incredibly difficult for them. But it's also really difficult for them during work hours too. So unless we're providing some sort of like childcare or something to support them so that they can get the supports that they need.
Great point. Thank you so much, Samantha.
On the radio at 5 o'clock, KTFC, I'll get the number right now. 263-3435. She'll tell you you're on live. Call her in tonight. She'll love it. Oh, okay. Yeah, see, it's a senior moments talk show. I used to do it with her. Yeah, she'd love a real call.
Thank you. Do we have everyone? I want to make sure we have everyone back in the room. Carrie, do I say all the peer support center folks here? Not really, right?
I don't see Davey. Oh no, there's Davey.
I see Davey.
And Thomas. Yeah, I think we're all here.
We're all here.
The Harbor's there.
Okay.
Oh, wait a minute. What are those?
I was just going to say, I don't see Edgar.
Yeah, I don't see Edgar either. So I don't know. I'll try to get a hold of him real quick.
Thank you so much, Carrie.
Yep.
I just want to.
Hi, Shell.
Edgar was in the meeting earlier, but he's not now.
Right.
That's right, Betsy. Okay, while we wait for Edgar to log back in, first of all, thank you all so much. And again, apologies for the Zoom snatch. That's always not a fun experience. So just to let folks know, we want to sort of now open up the discussion a little bit, but what would be helpful is to just hear from a handful of us around what were some of the small breakout group discussions. So I know, Jamie, Nimisha and I had our virtual discussions. Would also love to hear from the peer support centers about just some thoughts they had about the proposed strategies. Jamie, do you want to give a quick recap of what was the discussion in your group? And then I can call on the others too. Thank you.
Yeah, and so we actually had Circle of Native Minds, the Harbor, and Big Oak in my small discussion group. Okay. So yeah. So we talked, and folks, if I miss some things, feel free to kind of chime in, but just a brief overview, we definitely kind of talked about the staffing challenges and thinking about ways to kind of improve those, of thinking about offering more competitive wages for contract providers to kind of improve hiring and retention. There were also some ideas about thinking about the new peer support certification program for reimbursement. We also talked a little bit about outreach and training for IHSS workers and clients, and also potentially providing more employment support for folks in the community. So not just kind of like the mental health workforce, but folks who are going to the various peer support centers and seeing if there's ways that we can help them kind of get connected to employment. So that's kind of the broad strokes. Anyone from my group want to, if I missed anything key, does anyone want to chime in real quick? Okay.
Thanks, Jamie. I will, like I said, I will definitely open it up for a broader discussion. Nimisha, did you want to just chime in and provide broad strokes on the discussion in your group?
Yeah, definitely. I'm sorry for not being able to be on camera. My Zoom is being difficult. Mostly we talked about kind of creating a communication infrastructure that needs to be some sort of chasm between like the people within MHSA and then the surrounding services. So we talked about creating text message updates and also having someone contracted out from MHSA to do this work, because there seems to be providers who, even within the department, have differing amounts of knowledge of the services that are available. Yeah, and same if anyone from my group wants to chime in.
Thanks, Nimisha. And I'm also just going to give a quick overview of some of the conversation in my group discussion. There was talk about providing opportunities for alternative hours, so sort of after hours or weekend hours. And then Patty actually specifically called out Davies group, stating that they're trying to provide that opportunity, which is wonderful. And I think in addition to that, there was also talk around especially what it might look like for families with little kids, and if there's an opportunity to, if you sort of go down the alternate time schedule model where, you know, if childcare is going to be provided. That was definitely a thought. There was also talk about a need for more robust referrals, especially for early childhood, because that continues to be an area that is not being looked into very closely. There was also a need to really address some of the timeliness issues that were brought about. So, you know, ensuring that there's more consistent communication, thinking about more creative ways to deploy the workforce to address some of the timeliness challenges that were raised. That's really a very quick recap, but anyone from my group, please feel free to chime in case I've missed something out. I'd also like to use this opportunity to invite any of the peer support centers who would like to raise just some of the strategies that they discussed in your small breakout discussions. Please feel free to go off mute, and we'd love to hear from you. And also, this is a really opportunity for, you know, as we just did this very quick report back from each of our small breakout group discussions, were there any reactions or reflections or just additional thoughts that folks would like to bring to our attention with respect to proposed strategies?
This is Ishel Sparks again.
Yeah, please go ahead, Ishel.
You know, working in community-based organizations and in our communities, what I find to be a huge problem is the level of bureaucracy and the people at the top, like I said, making decisions. And someone said, you know, there seems to be a chasm. That chasm is always there because, frankly, there's a lack of respect for what the people on the ground are doing. And if we don't engage them in discussions where we can all sit together and you know, hash it out, you're not hearing what the boots on the ground are encountering and what they need. There's a deficit there. And that's why things don't work, is because people want to gather or want to say, this is what you're going to do with what you get, without hearing what the real needs are and what's going on in the communities. And those communities can be, I mean, listen, just in Lake County, there's a different need and a whole different culture in Clear Lake versus 25 miles away in Lakeport, you know. And so these micro areas need different things, but coming together to help each other at the table, you know, from the head to the boots on the ground is where I think we really get things done. Not, we'll have our people call your people. You know, and that's what I see over and over. And I said that at a meeting with the Department of Justice when they were handing down new rules. had a room full of victim advocates. And I said, which one of you was contacted by them? We were all across this United States. None of us had been contacted. We're the boots on the ground. How do you know what we need if you don't ask us, but you're so willing to tell us what we're going to do? And that's why it never works. And so just to have the conversations among all of the agencies and all of the people, from the leaders to the boots on the ground, that's where things get done. And you know, in my community, we waste people who are willing to help, our elders that are willing, even me right now, I'm not working. I'm willing to help. I'm sitting here because I care. I'm not getting paid to sit here. I'm here because I care. And I want to see us, I want to help however I can help. But we need to be, just because you don't have 6 letters behind your name, in Western thinking, that's different from me. When I see more letters, I feel like there's more trouble, you know? And so we need to value people for what they know, their wisdom, not the letters behind their name. And I think, you know, if we can engage the community too in these kinds of discussions, then we're going to get somewhere. But until then, it's going to be the same. Thank you for.
Thank you so much. Thanks, Michelle. We really appreciate your input. Thank you. Betsy, you have your hand up.
Yes, thank you. I do want to support what Michelle said just now. We encounter this all the time. In the area of older adult needs, there is an AmeriCorps program for seniors. It's called the RSVP program. It's administered by North Coast Opportunities. North Coast Opportunities has never done the training here in Lake County to help us implement that. And many of us, like Janet Taylor, for example, are volunteers. And that's a completely missing aspect of doing the outreach and all that kind of stuff. The second thing is I heard somebody say we need pamphlets at the peer support centers. I have written this to Carrie. I have written this to Todd. I am the secretary of the Mental Health Advisory Board. I am the outreach and education person for the Clean Water Program. I do radio programs. I have been on the air since 2008 on our community radio station. The Lake County Behavioral Health Services Department needs a public information office so that all of these different programs have one place to go to put this material out. There's a ton of material on different websites, different agencies. Nobody seems to be able to bring that together and make sure that we're not repeating this same effort over and over and over again. You have pamphlets, you got books, you got all kinds of stuff. We need to coordinate that and get it out. Thank you.
Thank you so much, Betsy. Any other thoughts, just, you know, on reflecting on what we heard from Michelle from the Circle of Native Minds, as well as Betsy. And I see that there's been some conversation in the chat. Thanks, Kim. Yeah, we're happy to receive more inputs from you. Thank you so much. Any other thoughts? I do also want to be mindful because we want to end this call at 12. So maybe we'd spend the next couple of minutes just talking through some other pieces if folks would like to bring that to our attention.
I just want to, I put it in the chat, but just on Betsy's comment, the Health Services Department does have a new POI, and one of the things that he's working on is trying to connect services around Lake County. And so this is a great opportunity for behavioral health services to reach out to him and see what we can do as a collective. I know that oftentimes we seem like we're separate departments, as we are, but to just serve Lake County.
Great, thank you so much for echoing that, Samantha. Any others? Any other folks from the peer support centers would like to weigh in? Well, I just want to reiterate, you know, there will continue to be avenues if folks, just as Kim has mentioned in the chat, if you'd like to send us an email, either email us or Scott directly, please continue to send your feedback and thoughts. We want to continue to invite that. And, you know, we definitely want to make sure that is represented in the report that we generate moving forward. So just talking about that, I'm just going to pull up my screen once again and just quickly sort of talk through next steps. And if folks have questions, feel free to ask me. So again, just want to reiterate, thank you so much. These were all really, really valuable inputs, and we cannot appreciate and thank you enough. So just want to sort of quickly talk through next steps in terms of what folks can expect. We're now getting into May, where we will be developing this annual update report. It will be posted for public comment around the middle of June, and then we're hoping to set up the public hearing where, again, it's an opportunity to have all of you come back and return, where we will be having a sort of similar presentation format, and hopefully folks would have had an opportunity to look through the report. That's sort of just in terms of the immediate next steps. In addition, I did want to mention that we would really love to invite folks to weigh in on our follow-up survey. We really take your feedback very seriously and would want to look for how better we can improve this whole presentation format. Again, I think folks at the peer support centers should have multiple copies available to them. Feel free to distribute that to the participants. And then for those of you who are joining us virtually, I think I see my colleagues probably dropped the link in the chat. So we want to really thank you so much for your attendance, and then feel free to give us your feedback. If folks want to chime in right now, they can do so as well. I'm kind of just monitoring the chat. Yes, thanks so much for that. Oh, there's a question from Betsy, which is POI stands for what? Was it Samantha? Was that you who had brought that up? Did you?
Yes, it's the Public Information Officer.
Okay.
PIO, sorry.
PIO. Okay, great. Thanks. Thanks for clarifying. Any other thoughts as we're getting into our last few minutes here?
Can I chime in and just say one thing?
Yeah, please, Jamie. Go ahead.
Like, this has been such a great, discussion. I feel like we've gotten a lot of feedback from all of you and some things that we haven't necessarily heard before, which we really appreciate. There has been like a little bit of discussion around the demographic forum, and I do just want to say, like, these are unfortunately indicators that we're required to kind of ask and report to the state. There is an option to do not decline. We can't necessarily change the information we're asking for, but if you have feedback around maybe the way that the question could be asked to make it feel a little bit less invasive, we would definitely welcome that feedback, in the feedback form or kind of in a different way. So just wanted to put that out there.
Thank you, Jamie.
Yeah, Michelle Sparks, I just wanted to say this, some of these things I know from experience with tribal elders and just with tribal people, some of these questions, they won't even give you a second chance. They'll disengage right from this point. So some of them I just frankly think are inappropriate to ask at all. But, as usual, the state and the feds dictate what goes on. But I just feel like there's no way to phrase some of those, or, frankly, what they have to do with a human being needing mental health services with some of it. And like I said, breaking people down into smaller categories with every question, it's concerning to me. But thank you for addressing that.
Yeah, I just might want to say, this is Thomas also, that we've come across that before, where a lot of these types of forms and documents that are printed or put together are normally done without any of the different groups involved in putting such documents together. They're normally, again, either a state or a federal regulation where they had no consultation at all with the cultural groups about those types of forms and how you can get actual answers and for the things that are in place. Thank you.
Thank you so much for raising that. All right, I'm going to move us this is really our last slide here. just want to reiterate how extremely grateful we are for this very meaningful discussion and conversation. We have some of our contact information up here. We have Scott and Patty's details from LCBHS. My email address is also up here. And also a quick note, we will, as you all are aware, we were recording this session, and that, you know, there is the slide deck, the presentation, which we're going to be made available. I believe they're already, at least the slides are probably already up here, but we will very shortly upload the recording as well. So look out for that if folks would like to access this, especially for those who may not have been able to make today's meeting. Great, I think we're pretty much on the dot, close to 12. I want to be respectful of everyone's time. Just want to reiterate, thank you so much. Scott, did you want to weigh in at all?
Yeah, I just want to, again, thank you for your participation. As I mentioned earlier, this is a very important process, and we're very, very grateful for the time that you have committed to be here, and the feedback that you have provided. We really do listen to everything that's said and try and incorporate it as best we can into our updates. And so we'll be working to take what we've learned today with the information that was gathered to do our update, which you will be able to see in around June 14th, 15th. So be looking for that. You'll be receiving an email letting you know that it is posted, and so we'll give you a chance to go look at it, and then hopefully we'll see you back here on July 14th, which is my wedding anniversary. So I know I remember that one. Someone else will be reminding of it, and that will be hosted by our Mental Health Advisory Board. So we're really looking forward to that. So thank you again.
All right, thank you all so much. Have a great rest of your day. And again, please feel free to reach out back to us in case there are any additional comments or thoughts you'd like to share with us. Thank you all for your participation. I'm going to stop sharing this and probably stop the recording as well. So thanks all. Take care. Bye.
Everyone.
Blessings to all.
Oh, go ahead. Oh.